Welcome to the DaVinci Hour podcast. I'm your host, Dr. Maxwell Cooper, and in this podcast series, I interview physicians, medical innovators, and entrepreneurs making an impact on healthcare. This podcast is produced by DaVinci Academy, a multimedia medical education company that provides podcasts, video courses, and digital textbooks. You can see more on our website, www.dviacademy.com, and our YouTube channel, youtube.com/c/DaVinci Academy Med. This podcast is sponsored by Doc2Doc, the personal lending platform designed for doctors by doctors. Do you have some big expenses in the near future? Maybe you're moving, applying to residency or fellowship, fixing up your car or home, or starting a new practice. Doc2Doc believes that traditional lenders overestimate the risk of lending money to doctors, residents, and medical students, focusing too much on the challenges of their financial past and giving them insufficient credit for the promise of their financial future. Check out Doc2Doc's personal loan options at doc2doclending.com/DaVinci. Hey everybody, welcome back to the DaVinci Hour podcast. I'm honored this week to be joined by Dr. Mark Royer, an ENT surgeon in private practice in Indiana, and then also the founder of ENT Surgery Solutions, a locum tenens firm for ENT specialists. So Dr. Royer, thank you so much for joining us. Really appreciate it.
Hey, thanks, Dr. Cooper. I'm really happy to be here. I've been a big fan of yours. I'm so impressed, and everybody says this, that they can't believe all that you're involved in as a resident. But even if you were attending with a whole team of people that were doing all these things, it's crazy impressive. Your podcast and your DaVinci learning materials and your medical device startup. So I'm a huge fan, and I appreciate you letting me come on and talk to you about locums.
Thank you so much. I really appreciate it. And thank you for the kind words. I guess starting out, we were talking before we started recording, maybe just give a little background about your private practice. Your wife, you were telling me is your partner in your practice. That's pretty cool. And so maybe give you an overview of just what your areas of clinical focus are.
Yeah, thanks. My wife, Allie, is ear, nose, and throat as well. We met in residency, and we right out of residency, we took hospital employed jobs as general ENTs. And so we were in a small town, a little south, about an hour south of Indianapolis, and loved it. I mean, we greatly enjoyed working together, enjoyed operating together. We did everything from tubes and tonsils all the way up to thyroids, head, neck, facial reconstruction. So we had a great time. We did that for about 3 years, 4 years actually. And the downside to that is when you're both in the same specialty and both in the same practice, and we were the only ones that were kind of covering the ER there. We were on call quite frequently and like all the time. So about 4 years in, when we decided to kind of focus on the locums company and move to a little bit further south to where Allie was from for help with our kids. Her parents had just retired and graciously agreed to help us out with them. We decided to kind of focus on an area of our specialty that has really grown quite significantly, and that's sinus surgery, nasal airway breathing, more quality of life surgery. Largely outpatient, a lot of in-office, and so we were doing that while we were working on and growing our locums company, and we still maintain that. We still maintain that clinical practice. It's kind of like our home base because our kids are in a school that they love with their grandparents around, and really enjoy being able to have a place that we kind of call home. Most of the year with the whole family in that kind of subspecialty practice.
That's awesome. Yeah, having family close by always makes things better and more enjoyable for sure. That's awesome. I'm curious. So how, you like you said, you were two busy surgeons. You had your practice, you got kids, you're raising a family. I guess what was the inspiration to start ENT Surgery Solutions? What kind of prompted that? How'd you get started doing that?
Yeah, so ENT Surgery Solutions is a locums company that specializes in ear, nose, and throat surgery for both call coverage and for service lines for hospitals. And so the reason we started doing that was because being the only two physician or ENT surgeons in this covering for this ER in our practice, when we were having our daughters or wanting to travel or just leave town, we had to find someone to cover our patients. And so we started using locum tenens doctors. And I knew nothing about locum tenens at the time. It wasn't talked about in residency. I didn't know anybody who had done it. And I actually hadn't even really thought this through when we're like joining starting this practice in this small town. Well, what are we going to do when our daughter's born, right? So like trying to figure that out is where we discovered locums. And the hospital, we were hospital employed, so which was great because they were then supportive to bring in locums doctors to cover our practice. And during the course of that, I got to know the docs who were covering for us, and I got to know their stories and why they were doing what they were doing, and kind of just from the personal side of it, learned about that. And then around that same time, I was starting to work on my MBA, and I was on the hospital employed side, so I knew what the hospital was paying the docs. I knew what the docs were getting paid because they became friends. And the whole point of an MBA is to try to find value, to create value. And I thought in my head, I was like, well, there's got to be a better way to do this. There's got to be a way to pay docs more and charge hospitals less, right? So I just kind of started thinking about that, and with Allie working on that and trying to figure that out, how we could potentially do that. And of course, at the time, I thought, oh, it's a piece of cake, but of course it wasn't, right? There's a reason that there's that difference, and that the locums business is a difficult one, and it was very hard to kind of get up and get going and start the whole process and the business. But we learned a lot in the process, and have now gotten to a point where we're really proud of what we're doing and what we're expanding and continuing to add and offer to the company.
That's awesome. So maybe taking a step back, maybe just walk us through like what locum, for any listeners that maybe aren't too familiar, maybe they've heard of it, but they don't. And I'll be honest, I don't know a lot about locums. Like I was telling you, I didn't really even know what it was till I got to residency and heard about people, attendings leaving and doing it, or
Sure.
bringing attendings in and doing it. So maybe give us like a little bit of background on that, and then how that also like ties into what where your company fits in with all that, like what like services you provide and that type of thing.
Yeah, absolutely. So great question. So we, you said you've heard about it in residency. I hadn't even heard about it until I got out of residency. And like I said, we needed it for our own sanity and ability to get away from just covering our patients 24/7. So locum tenens is Latin, and it literally means to take the place of, and traditionally has meant to take the place of a physician, like a position that was absent, whether from vacation or leave for some reason, or just having a gap in coverage. And traditionally, locum tenens doctors, I would say across the board, have had a kind of a negative connotation to it, right? So like if you see someone who's in the middle of their career and they're randomly showing up at some hospital filling in, I would say there's always been this thought of, well, okay, well, why isn't that doctor working full time somewhere else? I mean, that's just been that has been the conception. And I've seen even since I started using locums myself, and kind of the trend started before that it has become a much more mainstream, both career choice for physicians, but also a much more widely used for hospitals and health systems. So a typical, a hospitalist would be an example, right? A hospitalist is a very kind of straightforward way to kind of conceptualize locums, especially as the hospitalist system started taking more of effect as opposed to doctors admitting their own patients in town, internists, for example. You'd have doctors that would come in and work a week, work 2 weeks, leave, maybe come back, maybe do that once a month, twice a month. But as the demand for short-term physicians has grown, we've seen that spread to all specialties. And specifically in ENT, what I started to see happening was that there were a number of practices that maybe had 3 or 4 docs in their group, and they were independent practice, but they were maybe closely aligned with the hospital, and they started to be bought by hospitals. And so then they became employed doctors, and there were benefits of that, right? Their overhead was taken care of. They didn't have to worry about the day-to-day management. Then go from a group of 3 or 4 to maybe the oldest doc would retire, maybe they lose another doc somewhere else, and then they were suddenly a group of 2. or 3, and their call burden was such that, they were employed, so they were expected to cover the ER, and they were expected to make sure that their patients were covered. And that just became a kind of a difficult thing to do, especially as they weren't able to recruit in more doctors. And so from an ENT standpoint, just given the uniqueness of our specialty, and there are others that are like that, like vascular surgery, neurology, these kind of subspecialty surgeries, I saw that there was a need for call coverage. And so that's what we started doing, was looking for ways that we could help find docs who were working and needed to work in those positions, to kind of match up docs that were looking to provide some short-term coverage, and with docs that were in this situation where they were employed on call all the time and needed some help.
Sure. I'm curious. I feel like just anecdotally, I've noticed this, but I'm curious from your viewpoint. Have you seen a dramatic increase in locums as a result of the pandemic and, these staffing shortages, physicians leaving, that type of, thing? And then even just people, I think, realizing they can have more flexibility potentially.
Yeah, definitely. For every single one of those reasons that you kind of have, intuitively figured out. Like, you have docs who we had a number of kind of older physicians who, especially in ENT, when we're putting scopes down noses and we don't know what's going on, and they maybe had some comorbidities, or even if it's just older age, you're like, okay, well, I'm going to retire early, right? And so then you had a need for docs there. We also had more docs that were just needed in different specialties, like critical care, for example, and pulmonology. So hospitals really looking for physicians. And then I think everybody just kind of collectively paused and was like, okay, well, what is important to us? I mean, we're starting to see the shift among millennials and now especially Gen Z. I mean, it seems as though kind of our family time, our personal time, our time with our kids and our spouses really is something that is valued. And so I have a lot of docs that I talk to that are trying to look for a way that maybe they can get out of the just kind of continual full-time grind and work a week a month or 2 weeks a month. And so that as that becomes more in the kind of minds of docs who are looking for a different type of career, then because they're not necessarily working full time, then that opens up more need for docs. So it has been a huge shift that I think was trending in this direction, but was definitely accelerated through the staffing needs and shortages and different kind of creative ways that physicians were placed and staffed from the pandemic.
Gotcha. I'm curious, either just from in general or especially from also your company standpoint, who are using locums the most? Is it, people probably initially think, oh, it's probably like remote hospitals or, things, but even here in like a metro Atlanta, like I've heard of, major health systems like using, locums doctors. So I'm curious, like where does that usually, is it private practice first? Do academics use them? Those, I guess, where do you see the locums going?
Yeah, so this is an area that's changed a lot recently. It used to be that would have been a very kind of rural hospital for a very specific specialty, say hospitalist or ER, right? So those were the kind of the go-to ones that we're needing. We've seen personally in our business in ENT, but I was just at the national conference for the locum tenens organizations, and this trend is through all specialties, all businesses. The docs that are interested in providing locums are kind of all demographics now. It's docs that are working out non-competes, so they're maybe early mid-career. It's docs now, is a lot more docs are doing fellowships. Maybe they're kind of waiting a year to go into their fellowship and earning some income, or they're after kind of trying to give themselves a little time to make sure they find that perfect job post-fellowship that are working. We have a lot of docs that are in the military. Like a side note for the military docs that are working locums, they are just amazing, right? They're super hardworking. They have leave time that they're able to go and work. I take every single military position that I can get to work locums because they are just outstanding. They're loved by the patients. They do such a great job. So they're in the workforce and continue to be in the locums workforce. And we have a lot of doctors who are maybe not wanting to work till they're like 70 or 75 and wanting to slow down a little bit, but not just give up their practice completely in their late 50s, 60s, whatever. And so it's a great way for them to be able to maintain some continued licensure and stay in the field without feeling like they have to be on call Q2, Q3 with the case volumes that are required of that. As far as our clients and the hospitals that are needing it, it used to be very much just rural hospitals. Now we are seeing we have in our specialty, we have clients that are academic. We have both docs that are working for us that are in academics looking for, coverage options on the weekend to try and supplement some income. We also have clients where we're providing not just ENTs to those specialties, but subspecialty ENTs, be it pediatrics or head and neck. And that's true in all these specialties. We're getting extremely subspecialized locum tenens doctors, which would have never been the case before. It used to just be very general, and now we're getting very subspecialized for almost like kind of long-term and ongoing coverage needs, not just, coming in and, certainly there's the maternity leaves and paternity leaves that are being filled, or if someone's taking off for a medical reason, but we're talking long-term contracts for academic departments, depending upon what the specialty is we're seeing across the country.
That's interesting. And so for your company, it sounds like, are your clients obviously both the physicians, but then are your clients also the hospitals? I guess, like, what's the business model? Do the hospitals pay you guys for essentially like a list, or, probably more sophisticated than that, but like, access to physicians looking for positions, and then the other way around, I guess? How does that all work?
Yeah, usually it's hospitals or healthcare systems. Like it's almost exclusively that for our company and any locums company. It's not a viable, the expense of locums, of having locums, doesn't make a lot of sense in like a private practice model. So the clients are who are helping out providing staffing, and who's paying the locums companies are hospitals and health systems almost exclusively. And it varies. It used to be when, I was very laser focused when we started. I just want to provide call coverage, because call coverage is great, because the docs that we're helping out love it. Right. So even like they're employed, they're burnt out, they are overwhelmed. A lot of times they're ready to leave their job. And it's been a lot of word of mouth where I'll call them up and like, hey, I hear our field is very small in ear, nose, and throat. So it's like, hey, my friend who, trained somehow with, like, I hear you're kind of struggling with your position. It's not quite how it was when you signed on 2 years ago. And then, of course, they're ready to leave. I'm like, well, hey, look, here's what we can do. That's a win-win-win. We can get you some call coverage, and that'll give you some relief, whether it's a weekend, a month, or even just during the weekday. So you're not getting pulled away to manage a tonsil bleed while you have a clinic full of patients. A lot of these docs are RVU based, and so that's detrimental to that. It's detrimental to their ability to feel like they're underwater. The hospitals, they don't love to pay for call coverage, but it allows them to keep those docs happy and keep them rather than lose them and lose the service line. And then, the docs that are coming in and working, like that's what they want to do. They want to have an opportunity to be able to come in, but then they can leave, right? They can come in, really give it their all. Depending on this, some sites are very busy, some sites are really not busy at all, but they're able, when they're done, they're done. It's shift work. They don't have those phone calls incoming weeks later when they're not there with a question about, this or that issue. So it's a win-win-win. And that's what I envisioned that we'd be doing exclusively. Especially to kind of your previous question about, well, what's changed with the pandemic? One thing I have seen is a lot of rural hospitals especially have had an interest in trying to grow ancillary service lines, specifically surgical service lines, right? They want ortho, the urology, ENT. And so there's been a growth in actually requesting service lines. And so that has been something that we've really seen a huge increase in. And it's great because that really does help the patients. When you have hospitals that have the ability to bring that into their communities, especially in our field where we're doing ear tubes, for example, as one example, these kids, it's dramatic for them to be able to hear and then improve their speech and their long-term kind of academic and socioeconomic success. The studies are really fascinating. We see that directly, that they're able to get that because these docs are being brought into the community that they otherwise wouldn't have. So we've seen a lot more of that growth lately. So it's usually hospitals, health systems. A lot of our business specifically is providing call coverage for employed groups, but we're seeing a lot more rural hospitals looking for service lines.
Interesting. I'm curious also from, so if a physician's thinking of doing this, I guess what's the pace model like? Is it, and then I guess how does that fit into their taxes and all those types of things? I guess obviously this can probably vary depending on where you go and what your specialty is, but I guess how would it compare, I guess, to if they were working full time per se?
Yeah, so that's a really good question. A couple of things with regards to that. So as far as if they're thinking about doing it and they're kind of saying, okay, well, this sounds interesting. I want to know more. How would I start? A couple of like tips that I always give docs is, first of all, I want to make sure that they understand that there are a lot of locums companies out there. There are locums companies, and we've seen that even with COVID situation where we've had probably a tripling of the number of companies that are out there. There's an organization called NALTO, and that's the National Association of Locum Tenens Organizations. And that company has about 80 companies, has some really big names like Comp Health and Weatherby and locumtenens.com, who are the big players in there. And then it has mid-tier and smaller companies as well. They have to be, they apply to be admitted. But the importance of looking for a NALTO company, and I say this, we were admitted last year. So, with that disclaimer, but there are standards, there are kind of best practices standards that we all agree to offer and to stand by. And there's even internal kind of review of that. We have an ethics committee, and for any complaints, if there's a physician who has a complaint about one of the companies that we look into and investigate, and they're pretty rare, but it is a group of companies that are committed to making sure that you're provided the appropriate malpractice insurance, credentialing, communication standards, et cetera. So that would be the one thing. And, nalto.org is the website for that, and has the list of all the companies. If there's a company that you're thinking about doing, that's one thing I would ask the recruiter is, hey, are they NALTO members? Because that can make a huge impact on just the whole process and how it goes for the doc. As far as kind of once they've kind of found a company they're working with, the other thing, if you're thinking about locums, is I would say make sure you plan ahead. So it's not one of those things. I've gotten a few calls lately where you have a doc who's looking to just quit their job, or looking to quit their job, or lost their job, and they're like, hey, I have this like 1 month gap. I'd love to work locums next week. And even during COVID, we saw that like prompt licensing and credentialing was actually pretty rare. There were a few exceptions, a few specialties like critical care, for example, where the licensing became kind of, those emergency orders caused it to change. And so you could get a license pretty quickly. But even then, it was very rare. Usually the hospitals aren't thrilled to be paying for call for their employed docs. So we find that there's not a motivation to expedite credentialing. And then the licensing can take months. And in some of our states, it's taking up to 6 months to get licensed. We're talking a doc who's never had a lawsuit, who has no issues, never had any licensing issues. And fortunately now there's been a lot of media pushback on this. Like people are like, well, why are our docs not being able to get licensed? Why is it taking so long? We've seen that in a couple of states that we practice in, and so that's been good because that's then motivated the local licensing boards to answer the calls when the applicant's calling and stuff like that. So, but I just be aware that it does take months, not days or weeks, if you're thinking about doing locums. As far as pay, one of the big advantages of pay, a lot of people do like the fact that you are an independent contractor. You're getting paid in a 1099 form as opposed to a W-2. And so that, I'm certainly not a tax accountant there, but there are a lot of blog posts that I was reading as I was looking into this about, well, what are the benefits of that? And some of the benefits are you can write off certain business expenses with that 1099 income. There are some ways you can help save for retirement. So if you just Google 1099, the benefits of physician 1099 income, there are several really good posts that I've seen in the White Coat Investor, Physician on Fire, et cetera, that have explain that really well. And then the other thing that I really try to talk to docs about is the pay, because there's this, I would say, misconception that the pay for locums is actually some really, really high number compared to just standard pay. And it's different with locum tenens work as physicians than it is with where we hear a lot about this is travel nursing. Travel nurses can make 2 or 3 times what they make from a full-time job. And that just doesn't really exist for physician locums. And a lot of docs, I think, are surprised to hear that. It's not that it's not usually a huge reduction, but I always tell doctors when they call me up and they're looking, are you looking to work full time? I advise them, if they're looking to work truly full time, that the best option is to find a place that you like to live, a situation you're happy in, and really spend the majority of your like stay there, do that full-time job. You're gonna be better off. You're gonna be in a better financial situation than if you're trying to work full-time at a bunch of different sites. Where the locums pay or kind of financial situation works really well is if you're looking to have more free time, more autonomy, if you want to travel abroad for stretches, if you don't necessarily want to work full time, if you'd like to try different variations in practice models and locations, that's when it works well. But kind of plan in your head that take what a full-time salary would be and divide it by ever how many days you want to work. It's not going to be it's not going to be like double that or anything like you would see with travel nursing. It's going to be pretty much on par, more or less. And then, the other thing that I always advise docs about is to, negotiate their pay. I mean, just like in anything, if you're talking to a locums company and, except for ours, of course, we always give a very high and no need to negotiate for the rate. But in seriousness, if you have a spot that you're talking to a locums company and you found a place that you think might work for you, always, request, whether it's if you don't feel comfortable asking for more pay or think the pay is fair, then there are things that can be worked on. Like maybe you don't want to take as much time flying and there's like a nice nonstop flight from an airport, but maybe it's more expensive, ask for that to be covered. So I always advise docs, to do things like that with regards to pay.
I think that's an interesting point you make that about comparing physicians to like the nursing, because, I've heard about that as well, where some of these travel nurses are really making, compared to what they could make just at a regular employment, they're making considerably more money. Do you think that's more just a supply and demand type thing, or do you think that's also a nature of that just attending physician salary is so much higher, or is it maybe both?
Yeah, so I'm not sure. I haven't actually talked to hospital administrators about this, but what I know from other areas of physician salaries is we are really regulated, right? So like for an ENT to do a tonsillectomy, like they can only make so much, right? I mean, it's a little bit varies, but like Medicare pays so much, insurance companies pay so much. So then there are federal rules and regulations with how much a physician can make based on like Stark laws, anti-kickback laws. And with regards to nursing, they're not the ones ordering tests. They're not the ones doing surgery and deciding where those are done. So I think it becomes supply and demand then. Like for a hospital to stay open and to keep their ICU open, they need ICU nurses. I mean, they just do. So then that's where you're looking at, they're able to then double or triple in some cases the salary for travel nursing to bring it in. Otherwise, they have to close the ICU down. And physicians, I mean, ultimately they can't have a doc come in and just pay them some exorbitant amount, even though they'd like to have the service line, because essentially they do reach a point where it doesn't make financial sense. Number one. Number two, then they have to worry about, okay, well, does that kind of trigger some of these fair market value rules and regulations that might apply if they're overpaying someone, even if they otherwise wouldn't be able to find anybody. So I think those are kind of the main issues. I'm certainly no expert on that, but that would be my kind of take on why you can make so much more as a travel nurse than as an attending doing locums.
Yeah, that definitely makes sense. That
relatively, right? Like not absolute,
right.
But still, just like compared to the baseline, yeah.
Yeah, definitely. No, that makes a lot of sense. I guess how much of it, you hear these stories about, and this may just be people, maybe frustrated with their own jobs, but you hear like of, attendings quitting a place and then coming back as a locums, or like, things like that, or like you said, they use it to like get around their non-competes and things like that. And, maybe that's their prerogative if they want to do that. But I guess how much do you see that going on? And I guess is it more just kind of a varied reasons like you've mentioned previously?
Yeah. So the non-compete is an interesting point. We've had a number of docs in the past couple of years. They're not getting around their non-compete because they still can't work in the town or region, but maybe their kids are in school and they've got like a life set up there, and they leave and they're not allowed to work within like 50 miles of that town, but their kids are like in school and they're, they have friends or family or whatever, and they don't want to leave. So what do? Do you uproot the whole family and move them? And so we've actually seen a lot of docs here that are kind of like early to mid career, maybe 3 to 7 years in, that are in that situation. They're changing jobs into the same town, but those non-competes are really, really difficult to negotiate out of, to break. I mean, they're almost impossible. And so then they'll come and be like, okay, well, I may not, be able to work full time, but I can go for a 7-day stretch or an 8-day stretch. A lot of times we'll encourage, if it's, especially if like it's a school break, there's always a differential if there's a holiday. So Christmas, families don't really like to travel together on Christmas, but like, other school breaks, they like spring break, for example, we encourage the families to come along. I mean, many times we'll get like either an Airbnb if they want that or need that, or, for a bigger house or one of those like big kind of suite hotels or whatever. We want to make it as comfortable and livable as possible. And so bringing the family along oftentimes allows that. But as far as non-competes, yeah, it's kind of nuts. I mean, as a physician, I have my own kind of take on non-competes. I don't think they're great for anyone in the healthcare field to be able to kind of limit where they practice. And I think there are some attempts or discussions, at least, of getting rid of those. But in the kind of interim, the reality is they exist and they can be very disruptive. And locums has been, I think, a good way for a number of docs that I know personally, that have worked with us personally, to be able to provide a really good living while they're working that out, with also then balancing great family time. And kind of to counteract my point where I was like, oh, you don't make as much. Like, one of our docs was in academics and made a lot more doing locums, working less than if you just look at just pure hour, hours worked, because God bless them. Our attendings in academics, man, there are a lot of hours that they're putting in that they are uncompensated for. And so really what we try to do in locums is that's the reason why I think a lot of these docs really like it is, you're getting compensated for your time. There's none of this sitting at the computer, not getting paid to work. When you're taking care of patients, be it documenting in their note or seeing them in clinic, or, waiting in the hospital, waiting around for equipment or whatever to be done, like those docs are being compensated for that. So it makes you feel like your time is valued a lot more.
Definitely. My next question is especially relevant for, your field of ENT or really any procedure-based field, but I guess how much for locums, how limited are you on like what type of, surgeries can you do? What type of procedures can you do? And also on the other side of that, the legal aspect, like who carries the malpractice for that, or who covers the malpractice for that?
Yeah, that's a huge question that we get almost every doc we talk to. They're worried, concerned about the malpractice, and understandably, and it's a wise thing to ask, because I think as a physician, it is the number one thing we have to worry about. And that's why I go back to talking about the NALTO companies, because as NALTO companies, it's really, really expensive and difficult to get the locums companies' malpractice policies that meet the required standards, the standards that I'd want to have as a physician to take care of patients and to know that from a liability standpoint, I'm protected. So it's really expensive. So because of that, then you do have some kind of less than above board companies that can pop up and say, hey, come work for us, right? But they may not, and oftentimes they really don't have all of those requirements as far as the limits of coverage and knowing that the tail will be included and those issues. So to answer the question, it's the locums company most of the time that will be providing the malpractice policy. And that's just because we have, the barrier to get in to get that policy is so high that it's usually impossible for a solo doc to carry that themselves. Checking to make sure they have NALTO, asking those questions like, is my tail included? What are my limits? Like, those are really important questions to be asking. And kind of the other part of your question with what type of procedures can you do, right? As either an IR doctor, an ENT, or a vascular surgeon going to these places. One thing I really like about the call coverage gigs is that is so you're covering for these docs. Like, that's a conversation that you talk to them about, and as doc to doc, like, hey, what do you want me to do? What do you want me to transfer? Right. So, depending on where you're at, obviously at the academic centers or the children's hospitals, they're like the end of the road. So they're doing everything. When they leave, they have fellowship trained docs to kind of cover and change over to. When we have more rural hospitals and more like service lines, that is something that I think as physicians who run the practice, we're very involved in like making sure that up front, when we have the very first conversations with the hospitals there, and of course they want you to do everything and anything, but as physicians and surgeons and keeping in mind patient care, we really make sure that everybody's on the same page and understands like, hey, it's great that we can come here and provide care to these patients, but we're not going to be able to provide absolutely every surgery that they would need, right? What is our anesthesia situation? What is our nurse training situation? What are our ORs like? What do we have for after hours emergency room availability? And so we're able to do a lot, but we also are really involved from the kind of get-go with the hospitals of making sure that we know the limits of what can be provided. And that's a conversation we have when the docs are coming in as well up front. So that's a really good kind of point to make about when you are talking to a recruiter and thinking about doing it, like, and they're saying, hey, I've got this great opportunity in the middle of nowhere, New Mexico, and you can practice, it's great. You can practice anything you want to do there, right? Like, or you're expected to, right? So really digging into that. And if you can't get good answers for what level of care do I have available, who's taking care of these patients when I go back home or when I'm done with my assignment, saying, oh, they'll just be transferred. That is not, as far as I'm concerned, that's not an acceptable answer. So if they can't answer those questions, then I'd say look elsewhere, because there are companies that do greatly care and are aware of those situations, so that that you're going to be providing the best care and not leaving a patient in a lurch, in a situation of a rural middle of nowhere clinic who had a surgery done that maybe they should have not had done and should have instead been primarily taken care of elsewhere.
Sure. No, that makes a lot of sense. I'm curious from being a physician entrepreneur, that standpoint, I guess one, how are you balancing all the, a full clinical practice and then running the company? And I guess what type of, have you, how many, like, I guess, employees or, partners do you have to kind of help you run and build this company?
Yeah. So we have great employees. And so it's kind of been when we started it, it was just a ton of work, and we were doing it mostly kind of like we had accountants and interviewing for different accountants and healthcare attorneys to get the contracts and trying to figure out them out. I mean, it's just so much work. And in my MBA time, I'm like, oh, this is gonna be no problem, and it was just a lot, right? And so you're doing a ton, you're spending hours and hours and hours. Once we finally, and it took years, but once we finally got all of that groundwork laid. And now, especially being involved with the locum tenens organization, National Locum Tenens Organization, like you really didn't have a system and a plan. And so we have great employees who help us. But one thing that we've done that's been unique in our situation is, in our practice, we've been able to. So we have our specialty practice where Allie and I are in our like home base in Indiana. But as we have scaled the company and that has grown, we spend some time, like right now, we're actually on assignment covering for a site that had a gap in coverage. So we focus a lot more on doing that and helping the company grow than we, do. And like, it's not like we have a full-time practice back home and they're trying to do this, as well. It's really, we have kind of scaled into this as we've been doing it. And the other thing that's been unique about our business model is we have really relied upon and brought in physicians to help us with our different sites. So for example, we have a site that is a very busy level 1 trauma center. So we have a doctor who has military connections and kind of is our site director for that location. And we have different doctors in different regions who will work at those sites themselves, but they kind of coordinate those locations. And so they use their network to bring in doctors and make sure that company, those are all staffed. And then our company with our kind of staff members works on the back end to make sure the contracts, confirmations, malpractice, make sure that's all taken care of and handled. And so we've kind of rather than like just bringing in non-healthcare people, non-physicians, we've really, whenever we can, we've really relied on docs who work locums to kind of help them join us to grow it in the different areas. And yes, that's nice. And then working together, I mean, Allie and I love working together. It's something that we do very well. And so, if there's a situation, well, oftentimes we're in clinic together. So sometimes if like I'm on a call doing something or, doing a podcast with a really cool podcast host and we have a patient that needs to be seen, like then, she'll kind of flex in and see my patient for me, and vice versa. Although I feel like she ends up seeing a lot more patients for me than, than I do for her. But, same thing with our kids too. Like, it's kind of this one big, I don't know that we have a balance. It's just kind of one big, soup of kids and, locums company and, ENT practice that is crazy, but awesome at the same time.
That's really cool. That's amazing. And then I guess for your sites, are you mainly in Indiana or like the Midwest, or I guess where geographically, how far do you guys reach out to?
Yeah, so we are, Midwest. We kind of started and grew from there. So the furthest east, we're down in Georgia, we're down in Kentucky, Illinois, Missouri, out to Montana. East Coast, we're working on expanding. And I know you had Brad on for the New York and New Jersey ENT Associates group that is huge out there, right? So like they have 250 docs. So from an ENT standpoint, the East Coast is pretty much covered, I think, with just the practices that are there. So there's not, it's like those guys are like, oh man, we need help with call coverage. No, they're good, right? So we're not really in the East Coast much, but we're expanding. We have a site, West director who's located in Utah, who's working with our sites there. And so we are largely Midwest and South. In the West, don't have much in the East, but are continuing to grow every week. We're adding docs and sites, and then the other thing that we're adding that's been successful and that I think your listeners would be potentially interested in if they're thinking of locums. It really takes kind of an entrepreneurial minded physician for this, but we have several doctors who they have the site, like they know, hey, my buddies over in Park City, they need some help with call coverage, or I know of this. I have this hospital CEO friend who I met at a conference, and we go golf. We're golf buddies now, and they need an ENT service line. And so if there's these locations that a doc has, or these connections where they know the site, their client, and they want to work it, or then oftentimes I always say, hey, contract directly with the hospital if you can. Don't use a locums company, right? But the hospitals usually want to use a middleman because they want to maintain the independent contractor status. They want the malpractice to be taken care of. And so one thing that we've been doing as a physician-run company, and this is an area that I kind of a new area that I see growing, and that I think we're at the forefront of, and happy to talk to anybody who's interested in this if they have the site and they're looking at working in the hospitals on the contract directly, is we can provide all of the servicing. We have the infrastructure to provide malpractice and the contracts and the accounting, which can be kind of annoying, including like providing the 1099 forms, doing the invoicing. So that's something to keep in mind. If you just want to kind of go to work and work the locums job and get the that's great. But there are definitely some pay advantages if you've got those connections, or you're kind of networking around kind of as a servicing company. And so I think that's an area that will allow us to really expand into those other areas, because we just don't, we're physicians, we're practicing physicians, we rely on our physician network. So as like growth through those means, through physicians hearing about us has been huge, and I think will continue to be.
That's awesome. That's really a cool concept about having the physicians kind of if they're interested, leading point at certain sites and helping facilitate that. That's awesome. I guess as we wrap up here, I ask everybody, when you're not practicing ENT or running this company, how do you balance your life, if you can find any balance?
Yeah, so we really kind of the things we really enjoy doing are, I know a lot of people say, oh, I love to travel. Like, we really like it. Like, we have a little bit of a problem, but at the same time, it's been great with like doing a lot of locums work, because there's a brewery in Indiana that I love. It's called Open Barrel in Greenwood, Indiana, for anybody looking for the best beer made in the Midwest. They have a saying that goes, we brew the beer for ourselves, we drink it, and whatever's left over, we sell the rest. And so Allie and I kind of do that a little bit. Like, some of these ENT sites, they're like, oh man, we can go work for here or there, and and then we have docs that work a lot of the other ones. But we've really utilized that ability to travel a bunch. So we just got back from Cairo. We did this. They had this run around the pyramids, which was awesome, and Dubai. And last spring we took all of our kids to Europe. We were there for the spring, kind of like doing like a pseudo homeschool thing in the UK, and so we really enjoy kind of spending time together as a family. We like to hike. We like to travel and go around and live in different cool areas, and we do some fishing as well, and some a little bit of boating, kayaking, etc. So that's kind of what we really like to do to keep us balanced, is to kind of spend time together as a couple or as a family in a place that is not home.
That's awesome. Yeah, no, it's definitely cool to get out and see new places. And that makes sense as running a locums company too.
Right. It goes very well together. I don't know if, I don't know if we just kind of had that in our heads. This is what we like to do. And so then we kind of naturally gravitated to that, but it certainly has worked out well. And then also we do have that practice in Evansville. So we're able to bring in our locums docs when we are gone for extended periods to cover for that. So it's kind of been a really good way to have a really good, interesting, albeit clinically busy, but at the same time in a way that really gives us the kind of life, I think, the work-life balance that we really never thought we'd have, but are thrilled to be able to have as surgeon parents.
Sure. No, that's great. That's great. Well, Dr. Royer, thank you so much for taking time out of your busy schedule to come and talk to us about locums and what you're doing with your business. And I guess the last thing is, where can people find out more about it? Where can people find out more about the company, and then find out more about you and connect with you as well?
Yeah, well, thanks so much for having me, Dr. Cooper. This has been a blast, and I like I said, I'm a huge fan of yours.
Thank you.
Our website for our company is ENT, ear, nose and throat, ENT Locums, LOCUMS.com. And that's if someone's interested in reaching out to us about either ENT Locums, or, as I was mentioning, to help provide the locum tenens servicing if they would like to work kind of without the middleman. That's where they can reach out. Our email address would be info@entlocums.com. And then probably the easiest way is I'm on LinkedIn at Mark Royer MD. I have really come to like LinkedIn a lot. I know that's how we connected, and
Sure.
So I think it's a good platform, and so always happy to connect through that means.
Awesome. Well, we will definitely link those in the description, and thank you again for taking time out of your schedule. Really appreciate it. Really enjoyed it.
Thank you. I had a blast. Thank you.
Thank you for listening to this episode of the DaVinci Hour podcast, presented by DaVinci Academy. Please be sure to subscribe to our YouTube channel and follow the podcast on your podcast platform of choice to catch the latest episodes. Please leave a comment or a review and share it with a friend. Lastly, you can find all of our podcasts, video courses, and books on our website, dviacademy.com. Thank you for listening.